Lately, we've seen a lot of frothy action in the smaller development stage biotechs. But if you want a slightly more speculative, but actually investable biotech company, how about Seattle Genetics, SGEN? Here's a company that uses antibody-based technology to create drugs that can basically search and destroy cancer cells without doing damage to nearby healthy tissue. That is a big improvement over chemotherapy. Seattle Genetics has already one drug on the market, and the company has an amazing pipeline, including a number of late-stage drug candidates. Hence why the stock's rallied 110% since we first spoke to the CEO back in December of 2012. So let's take a closer look with Dr. Clay Siegel. He's the chairman, president, and CEO of Seattle Genetics. Dr. Siegel, welcome back to Mad Money.
Thank you for having me on the show.
Okay, we talked a lot about Acetris. We talked a lot about what's selling now. And drug companies, particularly biotechs, don't trade on that. What they do is they trade on the pipeline. And I've never spoken to you about how really broad it is. So you've got the floor.
Yeah, we have a number of drugs in clinical trials. Let me point to three of them that I'm really excited about. We have a drug that targets CD19, which is on a variety of lymphomas and certain leukemias. And we've already shown data that there's complete remissions in a number of patients. It's in early clinical trials now and escalating, but we're very excited about that drug. It's certainly a drug that has anti-tumor activity, but we need to do a lot more work to prove that it could be a commercial drug. The second drug is a drug targeted to the worst type of leukemia called acute myeloid leukemia, AML, where patients really die from that drug. There's not a lot out there. And we're in clinical trials with a drug that preclinically looked fantastic. So that's a drug we'll put out data later this year.
Okay.
And the third drug in our pipeline I will mention is for breast cancer. And it targets something called LIV-1, L-I-V-1, which is on 90% of women with breast cancer. So we think it's really an exciting drug that we're investing in. And all three of these are in clinical trials.
Okay, now I went on your website and there was a trial that began October 2013 for this breast cancer drug. I never want to give false hope, but I do like to present information. That's still open to people if they want to be in on the trial, right?
Yes, it's still open. It's a phase 1 dose escalation trial, and we're still working on the doses and upping the doses and trying to find what's the right dose to do larger trials.
Okay, Dr. Siegel, you mentioned this other trial that it seems it could be so promising. Why not open it? I know that you're talking about it's been on for 3 years. At the end of the year, maybe opening because it's just so good. If anything's so good, why not open it now?
Well, you know, we have a lot of different trials with different drugs, and we expand trials all the time. We're a very patient-focused company.
Okay.
We want patients to benefit. That's really what excites me. That's what gets me up every day in the morning, is really working to help cancer patients.
Okay, well, one of the things that occurs to me, and it's a little bit of a brutal way to put it, but how do you get people to be in your trials when a lot of what you do is for people who are about to die?
Yeah, that is the nature of trials. The nature of clinical trials in cancer is these are patients that have gotten what's conventional first.
Right.
And they haven't responded to it. Or they responded briefly and then relapsed. And they run out of things. So they look to clinical trials for potential hope. Now, for a company developing clinical cancer products, we need those patients to sign up for these trials. And it's really a very good symbiotic relationship there.
All right, well, Doctor, I'm sure there are instances where you probably believe that the idea of taking it for relapse, while good, could also be good first line. How does it work that someone says, you know what, this is really good for relapse, I wish I could give it a shot, and the FDA says, you know what, that's a good idea. How does that process happen? Yeah,
well, with Acetris, our lead product, we've shown and we're approved for two different diseases, Hodgkin lymphoma and a type of T-cell lymphoma in relapse patients. And so we've then gone ahead and tested it in frontline patients in a combination, and we've seen very high efficacy. So we went to the agency, the FDA. We've also talked to the European Medicines Agency, which is their regulatory body, and we now have 2 frontline trials designed, and they're accruing patients now to redefine frontline therapy for Hodgkin lymphoma and for T-cell lymphoma that haven't been redefined for over 3 decades. So that's what we're working on. We're investing deeply into doing something that's better for patients, more efficacious, as well as less toxic.
And one of the things I do like, besides just the incredible pipeline, is you actually have a pretty novel but incredibly good way of getting paid. You're a company that has great balance sheet, and I see some research that you have a possibility of $4.5 billion in potential milestone payments if everything goes right.
Yeah, we are first and foremost a drug company. We make drugs for cancer patients. And we have our lead product that's sold at Cetris commercially. It's approved in 39 countries. Sales in 2013 were greater than $250 million globally. That's our lead product, and we have other products in our pipeline. A second part of our business is we partner our technology with other companies. And with that, we've received over $250 million in payments to date and a potential of over $4.5 billion in milestone payments, plus royalties on top. So that's the second part of our business.
Okay, one last thing. In the second half of the year, you've got some, I'm trying to figure out the news flow, but there are some approvals that could come in the second half of this year, right?
Yeah, there's a number of exciting things, but there's one thing I think is very important is we have a phase 3 called Athera, and that's unblinding later this year. And that'll be sometime second half of the year, and it's a maintenance trial in Hodgkin lymphoma. And it's really important because docs need to know, they treat these patients and they need to know, should I keep them on this drug? And so this study will tell them if they should or not.
All right. Well, this is one of those that I think one day will be in that Biogen, Gilead, Celgene, Regeneron. It's the next level. I bet you're going to be in the top 5 real soon. Thank you to Dr. Clay Siegel, Chairman, President, and CEO of Seattle Genetics. You see why I like this one so much. Stay with Cramer.